that's okay.
Sure.
All right, so I'll just do the quick little housekeeping slide that we have next, but I did want to welcome you to our third HCBS Provider Training Grant for ARPA 1.05 with your direct care workforce team. Thank you all for being here today. Just some housekeeping items. We are recording. You probably just got the alert. Use the chat. There are several team members here that can answer your questions, and we are monitoring the chat. You're also welcome to raise your hand to ask questions as well. Meeting materials can be found on the ARPA grant website. That'll be dropped into the chat shortly. And then if you're listening by phone, welcome. Press *6 to unmute yourself or *9 to raise your hand. There is closed captioning once I turn it on here. And you'll be able to turn that on. There we go. I just turned that on, so you should have the option to do the live transcript or the closed captioning on your black toolbar. And team information can be found at our Direct Care Workforce Collaborative website, which we'll share the link to as well. So with that, it looks like we got quite an influx of folks, so I think we'll go ahead and hand it over to Tammy and Heather.
Thanks, Brooke. Hi, everyone. I'm Tammy Commander. I am the training grant administrator for this ARPA 1.05. Heather Johnson is our manager, which I'll have her introduce herself in a minute. And thank you so much for coming. I hope that it's a productive meeting. Heather?
Howdy, everybody. Thanks for coming over, and after I introduce, I'll hop back over and make sure we didn't miss anybody. Heather Johnson, I am the ARPA Long-Term Direct Care Workforce Unit Supervisor, which is a really long and very specific title. I get to work with 5 wonderful folks, all working on ways to help support the direct care workforce in the state of Colorado. And this is probably one of our favorite projects because we actually get to put money out into providers' hands. All right, and I'll be back shortly.
Okay. So this is the purpose of the grant. It is to offer higher level skills to direct care workers in order to retain and upskill the direct care workforce. This grant is specifically for HCBS waiver providers, but the grant is designed to supplement, not supplant trainings. And so we'll talk about that in detail in just a little bit. Next slide, please. Sorry, hang on one second. Okay. Sorry. Okay, the eligible applicants are HCBS waiver providers. They're also eligible for long-term home health who serve the HCBS waiver population. And then you must be a Health First Colorado provider. Training vendors and providers are also welcome to apply for the grant as long as they are offering the trainings to the HCBS workforce at no cost. Next slide. So this grant covers the training and all the training material cost. It includes the vendor quotes and then an itemized cost buildup and then how rates were determined. So all of that will be should be reported into your application included in your budget worksheet. Next slide.
Tammy, I just got a chat from Heather. There are quite a few folks over in that other Zoom room. So we are doing a mass exodus of that one to bring them over here. Okay. So if it's okay, folks, let's just maybe hold tight for a minute. And then if it's okay, maybe we can back up to the first slide and start again.
Okay.
All right. Sorry, everyone. Thank you for your patience. Let me just move us back a little bit here, so you'll be really well versed in. So let's just put a pin in it for just 1 minute.
Is it Monday already?
A Monday on a Tuesday. It's a double Monday.
Right. Thanks for your patience, everyone. There will be time to answer questions, just so you know. And in the meantime, please take a look at the instructions on the in the chat. I put the link in the chat as well. So check that out and review your applications, and let me know if you have any specific questions. I'll go through the slides quickly, and then we will do the FAQ at the end. Q&A, not FAQ, Q&A.
All right. John's hanging out in the other room and he'll send folks over. So maybe what I will do is kind of keep track of who joins, and then we can catch them up after.
Oh, Brooke's making me start over.
Oh, yeah.
Yeah.
We were only a couple slides in. We're going to do it again.
Yeah.
Okay. Continue.
Okay, so the training grant purpose. We have $9.5 million to give out. That is the training grant purpose. We want to train as many direct care workers as possible. That is the goal of the Direct Care Workforce Collaborative. And we are very, very excited to be able to give money out. Because we're the only project that's doing so too. So I'm really proud of that. This grant is to support the HCBS workforce. And the grant is designed to supplement, not supplant trainings. So hold your questions. We'll address any questions you have about that at the Q&A. Next slide, please, Brooke. The HCBS waiver providers, certified nurse aides and home health aides in working in long-term home health for HCBS waiver members are welcome to apply, as well as training vendors and providers that develop and or delivers training specialization for the HCBS workforce specifically. The grant will cover the cost of the training and all the training materials. So this will be a part of your, this should be a part of your budget worksheet. So please be sure to include all of the breakdown of the quote and the itemized cost buildup, and then how the rates were determined. Next slide. Applicants can apply for more than one award. However, applicants can only have one award at a time, like one award open at a time. So we're hoping to be as efficient as possible. Heather and I and our Direct Care Workforce team are here to help you get as many trainings in to your staff as possible. Because the training must begin after the award date and agreement process is completed, because of that, we're going to do everything we can to help you go through the process so that everyone can have an opportunity to apply for more than one award. And these are the grant award cycles. You can see that we're in our second grant cycle, and we still have 4 more. So please kind of keep those dates in mind. Next slide. Application can be found on the ARPA Grant Opportunities website. I put that in the link, and these are all the required documentation. Next slide. Okay, here we go. Any questions? You're welcome to put it in the chat or come off mute.
And Peggy, I believe you're here now. You joined us a little bit late, so we I guess a real recap would be the training is for not traditional training that you already need to provide for your workforce. It can't be QMAP, it can't be Maine, it can't be how to fill out an incident report. It has to be outside of the traditional trainings that you would need to onboard or recertify your direct care staff. While we do say direct care staff, it is for the HCBS workforce, so you can think a little bit outside of direct care staff. Let me see some other things to be specific. On the website in the FAQ, it lists all the ineligible activities. So while we would love to be able to fund things, there are certain restrictions that we have. We cannot pay for travel. We cannot pay for computer equipment. There is a pretty long list there of things we cannot pay for. We can pay for the cost of the employee to attend the training. So let's say you're having someone come into your agency to provide training on Alzheimer and dementia care, right? And so if in order to have those 20 people there for that training, they need to be paid, like that could be part of the included in there. What we couldn't do is give gift cards to everybody who came to the training. We couldn't pay for their mileage to come to the training. Just trying to think about a little bit of those caveats there.
There is a question in
yeah.
the chat, Heather, sorry. Has a list of funded projects been published yet from the first round of applications due end of November?
Tammy and I were working on that today. We don't have signed agreements yet. Those are just going out today. And so there's going to be an asterisk in that. It'll be coming out probably by the end of this week or next week. It'll list the awardees and the awardee amount. It's not going to be as specific for their training because we had to put the information out before we actually have the signed grant agreement. And we want to, be cautious of that. We did have 8 awards, cycle 1, cycle 2 closes the end of this month. We'd love to have more. So if you haven't applied yet, please do. Any more questions in there, Brooke?
Rachel's asking, can it pay for software used for trainings?
I believe it specifically says no to software, but let me make sure I am not speaking out of turn.
So that one is a little bit.
So no, software purchases is a no.
Okay.
Right, but I don't know if you need to purchase the software or if you're doing like a subscription based. I mean, even if it's a subscription or a membership based, we can't pay for the membership, but I know that some training vendors may what was I going to say, Heather?
It's Relias, where it provides like a portal where you can do a bunch of additional training. So if you have a program that's supporting like Alzheimer's, like you were saying, trainings, and you created a curriculum, but you also wanted to use some Relias videos, like that's where it's like, because it's a pretty steep cost a month to have Relias as like a portal of training. So that's why I was curious.
And that's where it gets a little sticky. It would have to be, because there are a lot of other trainings available on Relias, and we have to make sure that the funding isn't used for other training, because that could potentially be available. If Relias was able to give a quote saying, this is coming for this very specific thing, this is how it will be worked. I mean, I think that might be able to consider it. I don't know that they operate that way. If that is a little helpful, you might want to talk to the vendor and see what they are willing to do. We just have to make sure, because we're going to get heavily audited, that we are directing the money appropriately without that supplanting option. And if you have like maybe more granular, feel free to email us. And if you can talk to the vendor and see what's going on, or, we'd love to be able to look at something that supports. I don't want to give a blanket no if there's a carve out that can happen.
Cool. Thank you.
Sure.
And I see there's a couple hands raised. So let me get to Christy and then we'll take a couple chat questions and get to Whitney. So Christy, please.
Great, thank you so much. So you had indicated that in cycle 1, there were 8 awards. Were there 8 applicants?
There were about 20 some applicants.
Okay, so 20 applicants, 8 awards. Can you give us some sense of what was, I know nothing official has been published, but a sense of what was awarded?
Sure. And let me start with what wasn't. A lot, like, we understand that there is a need for onboarding, for assistance with onboarding training, but we cannot fund this with this grant. And so a lot of the requests that came in were really for that onboarding or the already required annual training that must happen. And so those were the unsuccessful applicants. Successful applicants, crucial conversations for their direct care staff, a mentorship program. So where you will pair a new direct care worker with a seasoned direct care worker and kind of work through a 90-day mentorship. So hopefully they're more connected. They're really going through some of those things that aren't really in the initial training. Dementia care was one of them, dementia and Alzheimer care. Another one was home, like supporting home individuals in their home who are experiencing mental health crises. So helping the staff with that. I'm trying to think some of the others. Up training, right? If you have homemakers and you want to get them through the training to personal care workers, so then they can serve more members and you can take on more members, that was an option. And collaborative safety, which might be like a trademark name. So really it was kind of just enhancing the skills that staff already have and taking it to that next level so that they can maybe support folks in a more holistic way and maybe in a safer way. So I think those were all the ones that's a rough outline of what was successful last time.
Okay, that's helpful. And then can I also just clarify, I thought I heard you say that we could submit as a part of the cost, essentially the time we have to pay for our staff to attend the training.
Yes.
Did I understand that correctly? Okay, great. Thank you so much. I appreciate that.
Let me grab a couple of these. Oh, sorry, Heather, go ahead.
Nope, go right ahead.
Okay, grab a couple of these chat questions and then I'll get to you, Whitney. Stephen's asking if a grant application is rejected, would the reasons for rejection be specific? An example, would it state that scope was too large or amount of request was too big, or if it did not meet the intention of the grant?
Yes, we try to be as specific, and a lot of it is really supplanting, which seems broad, but that's the letters that go out, the award and denial letters will say, let me add a caveat. Like sometimes we only approved one portion of the grant. Like they were going to do 3 different things, but 2 of those things included things we couldn't fund, but we could fund this 1/3 of it. So there could be partial awards that come out. If we're able to carve that out and it makes sense, we will do that. You will get in your letter saying what is approved, this amount, this specific training, or if it's a denial letter, where you missed the mark. And we always encourage people to reapply.
Perfect. Thank you. Whitney, let me go ahead and get you.
I think this question might have kind of already been answered, but I'm thinking about trainings related to maybe not a specific diagnosis or skill set of care, but more of general knowledge of IDD and how to be more person-centered, use plain language, things like that. Is that encompassed in this grant as well?
It very well could be. And I think it's how you're writing it. Like we're onboarding people. This is the initial training. This is the difference, right? Here's where we're training that gap. We want them to be here. This is where that gap is going to be.
Okay, perfect. Thank you for clarifying that.
And please keep in mind too, that, what we mean by supplanting trainings is anything that's available, like QMAP and CNA, those trainings are available for free through the state of Colorado at all of the community colleges in the state.
Just QMAP isn't, just so you're clear.
Oh, QMAP isn't, I'm sorry, CNA, the CNA training. So we wouldn't, because that's available through another program, we are not allowed to fund that particular training, if that makes sense.
Perfect. Thank you. All right. Let's see. Let me get here. Janet asks, in addition to funding our staff during training, can it pay for an outside trainer to come in for the training?
Yes. So you would want to get a quote, like maybe start off with a rough estimate of what that is going to be for that person to come. Now, we couldn't pay for their mileage. So then when you're talking with potential trainers to come in, then you'd want to say like, they're going to need to include like what in their rate that they tell you what it's going to take for them to be there, do it. So ask for that, ask them to consider that in their rate, because if they start piecing it out, you know, this much for mileage, this much for lodging, we can't fund those things when they're line itemed like that. And then when you think of training materials, right, are they bringing handbooks? Are you going to need, you know, is it best served for everyone to have a guidebook? You know, that would be covered under the training materials section. If it's just going to be some stuff that maybe you print out, then you would want to consider, is that something that would fall under the 10% indirect cost? Or is that something you really need to carve out in there? Training materials, we need to run down to the copy store and get this many, you know, just kind of think about all the stuff you would need. Are you able to use a conference room for free, or is there going to need to be a cost to that? And, you know, you'd want to speak to that. I know that a few of the trainings that were successful, and this isn't why they were successful, but they're really trying to get a broad reach across Colorado. So if they can benefit their agencies and then get other folks interested in it, you know, the training entities are looking at that as maybe options, you know, to maybe it makes it more worth their time if they can come and partner with a few different agencies. So I also wanted to make a real quick plug. We have asked all of the awardees if they want to be a part of a community of practice to help other folks kind of maybe problem solve ideas for grants. And they will be working through the Direct Care Workforce Collaborative with that. So if you haven't been to the Direct Care Workforce Collaborative or any of the action group meetings, we'd certainly encourage that. At least sign up to be on the mailing list, so then you kind of see what's coming in, and that might be something that would help you along the way as well. All right, go ahead, Brooke.
Yes, no problem. Cordelia, if not funded, could it be resubmitted in another cycle if revised?
Yes. Please resubmit it, you know, and just kind of look at that like, okay, supplanting, well, we can't get this, you know, we're not gonna, we want to spend this money. We want to get the money out. We just have to make sure it fits our parameters. So you know, I would encourage you to look at some of the other webinars, partner with some of the other folks that, you know, that might be successful to see maybe what you need to tweak. Tammy and I we can't give people specific help in that, because that's not, you know, available to everybody. So we try to use these opportunities as ways for folks to ask questions and us to give direct answers. Plus they're available on the website so anyone can look. So always resubmit and tweak whatever you think is needed.
Perfect. Thank you. Looks like Rachel's asking, how can an organization become a training vendor?
So there is no qualifications for a training vendor. We have some entities that are vendors. They've just identified some HCBS providers that they're going to work with, and they want to come in and provide the training to those. They're already a training entity. There's no specific credentials or anything that we would require for that to happen. It would just either people are creating the training themselves, or they're outsourcing to vendors that currently exist.
Awesome. It was just an idea of just creating a training to make it universal across Colorado. So I just didn't know if, they needed to sign off on or
Nope.
create that. So cool. We just specify that in the grant with all the moving pieces. Okay. Awesome. Thank you so much.
Thanks, Rachel. Whitney is asking, would CPR first aid fall into the not covered category as well?
Yes, it would fall into, because that would be supplanting, because by and large, that is already a requirement for a lot of initial training.
Okay. And then what about injectables, EpiPens, insulin, G-tube care?
So that's where I think you could make a case saying, right, this is what all of our direct care staff receive. In order for them to do more, take on more, we would be, you know, and then you're going to want to look at your regs and make sure that's something that, you know, that is within their scope. Because that would be, I mean, upskilling. I'm not a huge fan of the word upskilling, but that is typically outside of the scope of a direct care person in what their initial trainings are. So I think you could definitely make a case for that. You might just want to look at making sure that the regs support that.
Right. Christy, I see you have your hand raised, please.
Yes, I wanted to get clarification on if I'm a provider that has multiple different locations. Can we do a separate application for each location, or how?
If they have a different tax ID number, yes.
Okay, but so it's based on the tax ID
Like a
number,
Medicaid
not-
ID, yeah, like they have to be licensed. There's
Your
gonna have,
Medicaid provider ID number.
yeah.
Okay, so it's based on Medicaid provider ID. So if there's a different Medicaid provider ID for each location can submit their own.
Yes.
Oh,
Yes.
great. Okay, thank you.
Tiffany, please.
Thanks. And this actually kind of goes along with what Christy was asking. In the slide deck a few slides ago, it said applicants can apply for more than one award, however, only have one open award at a time. Yes, for me specifically, just to define open award time, looking at the award cycle, let's say we have one that's, in review, the award announcements going out mid-December, right? You would then have to fulfill the training before submitting another award, or just simply after the agreement has been met, we could potentially submit another one by the end of the month. I just want to make sure I'm clear on that.
Yeah, you would have to fulfill, because there's going to be a work plan that has your whole timeline for that award. And a lot of the ones we've had are across the whole year, right? But we've had some where they're going to try a very small, like, we're going to do this one-time training and see how it works. So that would make sense. They're going to be able to start and finish that in a pretty short timeline. So because there's a start survey, I'm going to call them surveys, like a start survey and an end survey and that final payout. So that has to be done before you can be considered for another one. Now, let's say, so this cycle closes January 31st. So let's say, that you are going to be closed. The next cycle closes March 31st. So if you know that between February and March, that other one's going to be done, you can apply in that time frame, because we're not looking at them until March 31st. So, and you might want to just speak to that in there, just saying, hey, that plan to close that out and then start the new one.
Excellent. So it really does match that timeline. So as long as we've stated this is kind of the start and the end of this training that we're planning to do, so that if it were to fall into a different award cycles to be able to submit for multiple, we could do that. I just wanted to make sure I was clear.
Yep.
I would say that you apply for the grant, you're awarded, you do the whole process of signing the contract and working on your work plan. You do the training, you pay for it, you get reimbursed, and you do the training in 1 week, or let's say, then you close that one out and then you're able to apply for the next one. Does that make sense?
Yes, that makes perfect sense. And ideally, if that training curriculum is in development of really having that item that's going to fill in the gap, that would probably take more precedence in that initial award. And then maybe subsequent awards would just be, okay, now we want to go en masse, spread this training, and that's kind of the future awards. Okay.
Yeah.
Yep. Thank you.
Perfect. Thank you. Whitney, please.
Yes, the final award date of October 13th of this year. If all that 9.5 million has not been given out yet, will this continue, or is that the end?
That is the end, because this is an ARPA project. We have very specific timeframes that we can roll in.
Okay.
So what would happen would be the money would be diverted either back, or if both the Joint Budget Committee and CMS say we can move it towards another project, because some projects have extensions. I don't know that would work or not, but the other part, we haven't published it yet. We're still waiting to go through clearance. Another part of this grant is there'll be individual grants for direct care workers. So they can apply for a grant for up to $500 to take trainings. So that will come out of this funds as well. Now, I don't think we're going to have, that's a small, no matter, we know we have a lot of direct care workers, but that's a lot for them. But so there will be a little bit more pulling from this outside of just the provider grants.
Mhm.
So help us.
Yeah. Janet, please.
Hi. So I know it's not the CPR training, but what if we were to do certification for CPR trainers? So train some of our staff to be CPR trainers.
So it still would be supplanting because you're required to provide CPR training to your staff.
Okay.
So that's how that would be, which I was kind of going to ask from the comments. Linda, do you mind giving any, I mean, you could say a friend, or if you want to give specifics to your question in chat about maybe what the training was, so we can provide some clarity.
Sure. So our training was a mental health training for home care workers. And the letter said it didn't meet the eligibility criteria or something along those lines. And we just could not figure out what was the specific problem with our training that caused the denial.
Okay. I say that, but then I don't have any of my stuff up to even help with.
Yeah, so the language in the letter was very general, and
yeah, and
have
that's
poured
kind of
over the
okay.
application and just have not been able to determine what we did wrong. We would
Sure.
like to resubmit.
Would you be willing, you can just do like the private message and tell me the agency name if you don't want to say it over chat, and that might help me do a little bit more research.
Sure. Yeah, that would be great. So I'll be happy to do that.
Okay.
Since I'm talking, another question we had, I wondered, one thing we wondered about was award amount. The maximum award that's in the application says $100,000, but then it says projects of all sizes will be considered. We did go over the 100,000 because we wanted to do a statewide effort, and we could just offer our training more efficiently that way, just in terms of structuring the staffing. So, one of the things we wondered is the $100,000 cap hard and fast, because the language that follows that in the application was a little bit confusing.
Well, and I can see how it can be differently interpreted. And I think like on our end, when we're thinking that is ask for 5,000, right? We can't go over 100. 100 is the max. And so we can take that feedback and look at revising like the RFA to be clear, like we don't want to deter people from applying for something small if that worked for themselves, because most people just went big or went home, right? Which is great, but we also like there's a lot of work involved in this, and if it makes sense for your agency to do it on a very small scale and then scale up if it works, that's that's kind of where that wording is, and I take your point that it definitely can be interpreted the other way.
We interpreted it the other way.
Yep.
So that
I
is
understand.
really a helpful clarification.
Yeah.
Thank you.
I'm not seeing any more questions coming through the chat or hands raised, so we'll give folks a few more minutes.
And I did join a little late because I was hopping over. So if it is helpful for you to know, when we do have successful awardees, the grant is split up, the payment is split up 20% when the work plan is approved, 60% for the bulk of the training, 20% of that award at the end when the wrap up is done. And so if that helps inform you on what that might look like, we'd like to give that information out. The other thing that that I wanted to point out is that we will ask for some data collection. It's pretty minor, number of people trained, and then, part of that training is having an evaluation method. So we do have a survey question we would like folks to include, or will we require folks to include in part of that training evaluation. You can bill as early as monthly if you have deliverables every month. Because we know that because it's reimbursement based and you're not operating off a giant pool of money, we want to be able to turn that around as quickly as possible.
I would say when the press release comes out with that maybe says the grant awardee, it would be it might be beneficial for you to reach out to those grant awardees personally and ask which training did they, you can ask more specific questions than we can provide answers to. Any other questions?
And Tammy, I know that you had put our email address in the chat, but I'm going to drop it in one more time.
Oh, thank you.
Just in case folks have questions after we leave here. Oh, Whitney asks, where would the awardees be posted?
You ask good questions. I know it's going to go out in an ARPA newsletter, and they're posting awards for all the different grants that have been out. So it would be on the website for probably the ARPA grant opportunities. And if you don't mind, drop your email in the chat, and when I do find that location, we can make sure that we send it out to you. And I did want to go back to Linda. So scale it down is probably the best advice. So if you're, because there's that 10% indirect cost in there, you can manipulate the 10% indirect cost, or just assume we're going to cut your grant to make sure that's no more than $100,000, because that's our limit. So we look for what we could carve out when you have it kind of itemized on that budget worksheet. And so if you're asking for, and I usually put the, if requests come in that are more than 120% of the $100,000, we just, like, they're at the bottom of the list, because it's a lot of time to go through for the grant review committee for something we know we can't fund, and we don't know how to pull and carve that out. So we know that grant requests are going to come in for like 108,000, 110,000 if you don't manipulate, you know, some of your funds, and then we'll figure out what we could carve out, or we might have to have some back and forth. But that would be my suggestion, Linda, is just scale that down so that it falls within the parameters. And I think Christy had brought it up earlier, like if there are opportunities for other agencies to kind of partner and apply for their own, and it kind of makes sense, maybe look for some like community work there that could work so that it could benefit the whole state, because we'd love that, right? We just still have to stick within those $100,000 requirements.
Thanks, Heather. That's really helpful.
In your applications too, on your budget worksheets, it's great to give a lot of detail. If you know which training that you want to do and you want to provide to your direct care workers, please just write it all out so that we can see exactly what trainings you are wanting to do. I think that's reasonable to say.
I think so. Perfect. Well, last call for questions. I want to make sure everybody gets a chance. If not, you're welcome to email us again if any questions come up. We're happy to respond there. And yes, thank you all so much for coming today. This will be available on the website, the recording. Oh, Whitney, please go ahead.
Sorry, I have one more. I've had so many. So if, as a provider, if we are currently not offering a service, but we get approved for it through the department, and we want to train our staff to do that, like personal caregiving or supported employment types of stuff, is that considered onboarding for that new service we're providing?
It would.
Okay.
Yes, it would. And so then I would look at, like, yeah, what's maybe that next level thing that you might be able to do.
Perfect. Thanks.
And
I promise I'm all done.
No, that's fine. We welcome the questions, and we will host at least one of these informational webinars per grant cycle. And so we always encourage people to look at the OCL calendar or email us, and we'll tell you when we have it scheduled. And please, like, tell a friend, tell other folks about this. We'd love to, like, Tammy and I want to be swimming in applications and out of money by like July. So if you can make that happen, we would love it.
Thanks,
Thank
Heather.
you all.
All right. Thanks, everyone. Take care.
Thank you.